According to the CDC, there are currently 93 reported cases of the measles in the U.S., up from just 14 a couple of weeks ago.
The world is watching as Pope Francis is spending a 12th day in the hospital in critical condition with double pneumonia. Dr. Jeff Pothoff from UW Health is here to talk with us about both of these topics. Hello.
Hi, Dr. Pothoff.
Yeah, according to the Vatican, Pope Francis is in critical but stable condition, but double pneumonia, that's very tricky to get past.
It can be. So, I mean, you have two lungs, so to have double pneumonia, you've got infection in both the left and the right lung. One that can make it hard to actually breathe, so sometimes you need oxygen. Sounds like the Pope doesn't need help with ventilation, like a ventilator or BiPAP, which is good. But then you always risk the chance of that infection becoming in the bloodstream and making you much more sick with sepsis. You treat that by getting people on IV antibiotics right away, make that less likely to happen.
He's had a couple of complicating factors, too. He's needed a blood transfusion, I understand. There was some talk of possibly kidney issues. What's your read on how serious this is?
Yeah, hard to say for sure because just a lot of the details are out of there, but you can have kidney failure from this double pneumonia kind of one of the two ways. One, you could have got septic, you have low blood pressure, that'll put you in kidney failure, or you were sick, you weren't staying hydrated, you get volume down, that can cause kidney failure. The blood transfusion would suggest that maybe there was some degree of anemia, or sometimes if you get septic, there is a process to get people's hemoglobin up a little bit higher than maybe even their baseline is. Hard to say. It sounds like maybe he's coming around a little bit right now, but I think he's 88 years old, so there's always that too. Age isn't working for him right now.
But you think it is survivable?
Oh yeah, it's certainly survivable, but at the same time, don't want to be dismissive of, double pneumonia in an 88-year-old can be sometimes not survivable too.